So what surgical options do we have then for a tear to the cranial cruciate ligament? There's essentially two broad categories of types of surgeries. One is the concept of trying to replace that cruciate ligament. So put something back in there that acts like a cruciate ligament. And most commonly that's done with a synthetic ligament, the most common being a lateral suture or an extracapsular repair. The other most common one would be something like a tightrope style repair, which uses bone anchors or bone tunnels to allow a synthetic ligament to be placed. Now, all of those ligament procedures rely on an external suture, so outside of the knee itself. Now, again, the cruciate ligament is within the knee, so remember that it is actual a ligament within the knee. So when we replace the ligament with something outside of the knee, we are what's called eccentric to the center of the range of motion. So what does that mean? That means if you're at the specific point of range of motion, or the center of rotation, then you don't have any movement or motion or stretching at that point, because that's the center of rotation. It's like thinking about a circle and you put a dot in the center and you turn that circle and that dot stays in place. Now, if we're eccentric to the center of rotation, then we get stretching motion every time that that leg rotates or stretches and extends. So now think about putting a dot in the middle of a circle that's not at the center. And now you spin that circle and you can see that that dot is moving within the circle. So the external or the extracapsular suture repairs, or those types of repairs, have this continuous stretching load that's being placed on them. So they have the propensity or the risk of early stretching or implant loosening that can cause them to have failure down the road. So though they are good repairs for specific instances, the other class of surgeries that we offer, called the biomechanical classes, tend to be more stable post-operatively. So there's less risk of a complication once we get healing to occur. So what is a biomechanical repair? The TPLO, or the tibial plateau leveling osteotomy, would be one of those procedures that are in the biomechanical class. So what does the biomechanical class attempt to do? So we talked about the replacement class tries to put a suture in or some sort of material at the exact same location, or to act as though it was a cruciate ligament. The biomechanical repairs try to change the way that the knee actually works so that you no longer need a cruciate ligament. So you aren't actually replacing it. You're just altering the way that the knee works to allow us to have stability without a cruciate ligament. All right, so how does the TPLO procedure actually work, or how do we do the TPLO procedure? The cruciate ligament would be this ligament right here, okay? The top of the shin bone would be drawn here with this line here. So what we'll see is that's a pretty steep slope to the top of the shin bone. So the end of the thigh bone right here essentially looks like a ball bend sitting on top of a very steep slope. The cruciate ligament is what prevents that ball from being able to roll down the hill. So you lose that cruciate ligament, and then you can freely have that ball then rolling down that hill. That creates instability, which can do things like pinch the meniscus and cause discomfort and arthritis down the road. So the TPLO procedure says, well, what would happen if we came in here and we actually made a half circle cut in the top of the shin bone? So we come in, we take a bone saw, and we actually cut the top of the shin bone along the angle of the joint. And this is down below all the important structures of the knee. That allows us to rotate the top of the shin bone backwards, so that now, instead of having that steep slope to the top of the shin bone, we're going to have a nice, flat, level plateau. So again, now we look at the end of the thigh bone, which essentially looks like a ball, and that ball is going to stay nice and stable on the top of the shin bone because it's no longer on a slope. So we don't have that instability anymore. So then if we take a bone plate and we put that back onto the bone here with some screws to hold it all back in place, now we have a nice stable repair that's going to heal by bone healing, which is a very reliable way of healing. That heals back to 100% functional strength by 8 weeks post-operatively. So we have a nice stable knee and a nice stable repair.